Hello and good afternoon. I know some of you are off on your lunch and you might be thinking what's going on today. So this is the live CDA TV. So thank you very much for joining us. We've got guests today from Cambridgeshire County Council and they're talking about their strategy for the adult health and commissioning for 2025 over to 2028. So we're going to be having a look at the council strategy. They want to improve the health, the care, the services, want to support unpaid carers as well. And obviously that's going to be for now and for the next few years. The strategy is focusing on helping people to improve their lives, to stay independent and to keep their well-being at a really, really good level. We want to reduce the inequalities. We want to make sure that there's support here for the local community and the support there is for the people who need it. The strategy is going to be looking at all the different services and partners and working out how they can work together, how we can use technology to improve the care support for residents within the area. So this chat and discussion is sort of for us to understand what is this strategy, what is it about, who's it going to help, what's it going to do for the community, for deaf and disabled people. So I'm really excited to say we're joined by two people today. So we've got Sunny Singh.
Hi, thank you Matthew. Thanks for having us here today.
Brilliant, thank you. And the second person is Carol Williams.
Hello Matthew, it's very nice to be here. I'm Carol Williams.
Thank you. So welcome to both of our guests. So they work for Cambridgeshire County Council. And we've got Rachel, our interpreter today. Obviously, we know today is a live discussion, so don't worry that we're not going to be ignoring our viewers. It's really important to get your feedback, your comments, your thoughts. Any feelings as well that you want to send, please do. I'm going to be keeping an eye on any comments that we do get throughout our discussion. So now's time to start the discussion. So thank you, Sunny. Please could you introduce yourself, your role, what you do on a day-to-day basis?
Yeah, thanks Matthew. Thank you for having us here today. So my name's Sunny Singh. I work at Cambridgeshire County Council within adult social care. For those who don't know what adult social care is, because it's quite broad, adult social care supports a range of different people within their communities. So it's predominantly for older people, so people 65 plus, people with learning disabilities, people with physical disabilities, people who might have sight loss or hearing impairments, and also their carers. So it's a really broad range of people that we support across Cambridgeshire. My role is Strategic Development Manager. I sit within the Strategy and Policy and Delivery team, and we do a range of different activities. I'm here today to talk to you about some of the work that we've been doing around engagement for the strategy.
Brilliant, thank you. I look forward to hearing more. And Carol, what about your role? What is your normal day-to-day as well?
Well, thank you, Matthew. I'm Carol Williams, as I mentioned earlier. I'm also a Strategic Development Manager within Adult Social Care at Cambridgeshire County Council, and I work in the same team as Sunny. And our team has a variety of activities that we do to support the general running of adult social care services. Some of that will be really relevant to the people who are watching today in terms of, for example, we support our public-facing information and advice about adult social care, and we also do a lot of activities to support people to be engaged in helping to design and set up services. So really we were here to talk about some of the engagement activities we did on this strategy, but also we're really happy to take questions as they come through. So thank you.
Brilliant, thank you. So this strategy, I know there's a lot of people out there who might not realise what is a strategy, what does it actually cover, what is its purpose too. Is there a way that you could explain sort of in brief terms what is a strategy, why you have it and why it's important?
Yeah, so the strategy came around because we decided that we needed to be a little bit clearer about what our objectives were in terms of adult social care. So it helps us to provide a picture of the different areas that we work in, but also what our ambitions are. So the strategy's really helped us to kind of distill what we want to do in terms of new delivery, what we currently do. And hopefully when people pick that up, they'll have a better understanding of what they can expect from adult social care in Cambridgeshire, what might change over the coming years as we work towards some of the ambitions within the strategy, looking at things like how we improve public information, for example, how we look at reducing inequalities for some of our communities. So it's really a broad kind of overarching view of adult social care, and we will use this strategy to be our benchmark. So we're very keen that we kind of look at what we're doing on a 6-monthly basis to actually make the strategy into reality. It's great having a document and a vision document so people can pick that up, but people want to know, and what does that mean for me? So we're really keen through conversations as we develop the strategy to hear what people's experiences are, and we can feed that back into the delivery of the strategy, making sure that our services and the services that we commission are what people want and they reflect what people need.
Oh, I totally agree with that. There's no point in just having a paper piece of strategy. You need to explain and go and work on the background and everything that goes into developing a strategy. That's the most important thing. You say about reducing inequalities. Are you able to explain more about how you feel you could achieve that?
Yeah, so we work with a range of different partners around a lot of the areas within the strategy itself. One of those areas that we work alongside is our public health section within Cambridgeshire County Council. And they have a mandate to look at actually how people are accessing public health activities. So it might be things like smoking cessation, it might be things like weight management. So there are a lot of those responsibilities that fall within our public health remit as well. For adult social care, it's a really broad range of things. So it could be things like reducing inequalities for people to access services. So we know in Cambridgeshire sometimes transport isn't great. We know that people might want to access things that might not be there. Unfortunately, we all probably know that we work in a really financially constrained environment, and sometimes the services might not reflect what people want. So we want to make sure that if people want to access different services or activities, they're able to. So the reduced inequalities section really kind of distills some of that work, looking at our main priorities and how we can improve things for our communities.
Oh, that's brilliant, thank you. So you talk about these priorities. I'm thinking, have you got a main priority or a few specific priorities, or even yourself, Carol, that you're looking at working towards?
So when we were developing the strategy, we wanted to make sure that it really linked from the top of the council down to the sort of on the ground. So it links into the wider vision for the council, which is known as the strategic framework. So that's the sort of vision for how the council will operate. And within our strategy, which was co-produced with people in the community, it works on 6 ambitions. And so they cover areas of work that are really key to making sure that we can deliver services on the ground. So that is to do with improving access for people, which we've touched on a little bit, but it's also things like focusing on safety for people. It's having a more place-based approach, so thinking about how we can do things more locally and nearer to people in their community. It's being innovative, so sometimes it will be actually changing the way we help support people in the community. And obviously a lot of the activities that an organisation like Cambridgeshire Deaf Association does are really innovative and actually help people to access services and find out more information. We've also touched on the fact that we want to reduce inequalities, and finally we want to make sure that we are providing enhanced carer support for all the unpaid carers in the community who are taking on that vital role. So those are our core key ambitions. And obviously, as Sunny said, there are delivery plans and actions we're going to be doing below that, because we very much want the strategy not to be something that's like gathering dust on the shelf. It's got to be a live document where we're actually doing real work on the ground, and it's going to be meaningful for people.
That's brilliant. So with this strategy, what exactly are you putting in it to achieve? Like, what details are in there? What evidence do you need to put into the strategy for you to then be able to go into the community? Is there like a specific list of things you're trying to achieve?
Yeah, so we, underneath the strategy are a set of delivery plans. So absolutely, as you've just described in the question, Matthew, we will have a list of things that sit under that. So, for example, in Improve Access, we're looking at our information and advice offer as a local authority. So we've currently got a large programme where we're looking at all the web content to do with adult social care and improving that. So we're looking at stripping out all the jargon, writing in plain English and making it a lot clearer for people to navigate. So we know that concepts and the areas around adult social care can be quite complex for people, especially if they're hitting it as a crisis. So we're trying to make sure that the information on our website is clearer. And that's part of one of the delivery plans that sits under Improve Access. And there is one delivery plan for each Aspire ambition, which outlines a number of different projects and activities. And we will be looking at what we're doing to achieve that as through reporting sections that we have.
Brilliant, thank you. So you mentioned Aspire. I'm not too sure if the audience will know what you mean by that. So are you able to go into a bit more detail?
Yeah, the Aspire ambitions were developed within Cambridgeshire County Council to support our adult social care staff. And they really look at some of the main areas of support that we want to provide people in the community. So Aspire spells out our ambitions. So A is for improving access. S is for safety, so it's very important that people are able to access activities that are safe, but also safeguarding, which plays a major part of that as well. P, which is about place-based support. We need to ensure that people can access services that are close to them in their locality at a time they want to, so it's really important that we deliver our services with a range of different partners like CDA to meet people's needs. I is for innovation. We know that there is a lot of movement around technology and AI, for example, and how that can be used. So we're always looking at different technologies that can be used. So, for example, we have a carers platform called Bridget, which supplies information for people who might be given unpaid care, and it provides lots of different information, and you can have an AI chat with that as well. And E is around a really major part of work around enhanced carer support. We know that there are lots of people caring for people in vulnerable positions in Cambridgeshire. We need to make sure that we support those carers. We actually have a legal duty to support those carers. So we have a really large piece of work around enhanced carer support as well.
Oh, brilliant. Thank you so much. It's so interesting to hear. So audience, the deaf community who are watching today, what do you think about the strategy and these ideas? Have you heard of the strategy before? Have you heard of Aspire? Please do give your comments and we can pass them on for you. So I'm thinking specifically about the deaf community and their perspective. So I'm from a deaf family and I spoke with my parents today to say, you know, the council are setting up this strategy and they had no idea like that you were doing it or what it was. So I think it's important to make sure that the deaf community are aware that you've made this strategy and that you're using it as basically a placeholder for everything that you're doing within the council. Yeah. And I think it's a brilliant idea, but obviously it needs to get out in the deaf community. So I was just wondering what your perspective was on making sure that the deaf community can access it.
Yes, we would agree that one of the challenges making sure that people are aware of the strategy and what it can do for them is actually being able to give people information in a format and a way that works for them. So obviously one of the things we're doing today is hopefully raising awareness about the strategy within the deaf community. As you're aware, when we were actually developing the strategy, We took quite a long time to do that over a number of stages, and we did various forms of engagement where we went out to meet people in person, we did stuff online, but also with the help of Cambridgeshire Deaf Association, we created some BSL videos for one of the surveys we did related to the strategy, because we really wanted to make sure that the deaf community were involved in actually its creation and can give their feedback. However, we're aware that there's a lot of work we still need to do to broaden our offer for the deaf community. And as Sunny mentioned, one of the things that we're working on is our public information offer. Some of that comes through our website, but also through other means, such as the sort of live stream today. And we're conscious that actually we're maybe not giving information to the deaf community in a way, in a format that works for them all the time. So we're obviously wanting to do this in-person type of engagement, but also we've been having meetings with people who are producing AI solutions that might in future be able to support members of the deaf community to be able to get information about their services, to be able to really give their feedback. We do have engagement organisations that we work with, people like your health watchers and other voluntary sector groups, as well as obviously Cambridgeshire Deaf Association, but we're conscious that there is still a gap and there's still work we need to do. So very much this is the start of that process, we think, of hopefully doing more of this kind of engagement, and that would then mean that your parents and others would maybe get to hear earlier and better about things such as the strategy. But really what it's about is the delivery and the work. So hopefully that will improve as we go forward in the future.
Oh, brilliant, thank you. So if I, go back a bit to the basis of the strategy. So this is obviously based within adult social care. And what specific parts are there that you are focusing on within adult social care, within your services, within the local communities and deaf communities? What are you trying to focus on with this strategy?
I think we want people to have an improved experience. We know that there are lots of different factors that impact people's lives that sit outside of adult social care. We know that there's a financial crisis, a cost of living crisis for people. There are lots of different competing issues for people. But what we want to make sure is that when people come to adult social care, the offer that they get is clear, the experience they get is good, and the information that they get when they need it is correct. So we're really working to make sure that people have an improved experience. That is the main and overarching kind of objective. That sits beneath the strategy is how we do it, but actually at the heart of it is making sure that everybody in Cambridgeshire who accesses adult social care is safe, well and independent as a result.
It's also important to say that we know that people don't live in a box called adult social care. They have lives that are complex, they are involved with health, they're involved with transport, they're involved with the benefit system, and part of what we do is also to make sure that we join up with those organisations, those services, and try to help people navigate their way through if we can, and we get feedback about how those things are impacting on their lives. So some of those things we might be able to actually directly have an influence on because they will be services that the council actually helps to run. For example, it might be to do with the state of the roads and the potholes and things like that, which is obviously people will know about at the moment and things like that. But it's also where we can actually really work with partners, for example, our health partners, to try and improve people's experiences so that their lives are actually being supported in a holistic way and not just we're going to provide some care to them. It's actually much bigger than that. Their lives are much bigger than that.
Yeah, definitely. And you've obviously mentioned about health. For the deaf community, access to health is a big issue. The lack of access with sign language interpreters. There's a lot of gaps out there. There's a lot of deaf people who can't access health. So yeah, what do you think you'll do to solve that?
What? Sorry. No, I was going to say that one of the pieces of work that we're very involved with is to do with actually hearing people's lived experience of their, about health and social care services. We work very closely with Health Watch, which are the local champion for health and social care, their voice for people. And we actually work very closely with them to try to highlight these access issues to health services. So we hear through the engagement that Health Watch and other partners do with members of the community about their difficulties and actually, accessing GP surgeries, getting appointments at the hospital and things like that. And it's to do with the way that they're sent information about their appointments, how they get to the appointments. I was in a meeting only yesterday where we were talking about community transport and the difficulties there were about the fact that a lot of that community transport is taken up with trying to get people to health appointments alongside obviously the passenger services that are run by health services. But there's such a pressure on those services, such strain, difficulties finding volunteer drivers and so on. And so it's really difficult for people to get to their appointments. And that's the wider community, let alone people who may have additional access needs as well. So what we can do is, obviously we can gather that feedback through our work we do, but also our partners do. But then also take that information back to those services and say, actually, how can we improve this? How can we do better? So we might be talking to the local hospitals about their access. And that can be anything, as we said, from, the information they sent out about appointments to, being able to park at the actual sort of places, the hospitals, in the car parking and so on. So it's all those kind of things about access. And that will obviously include members of the deaf community and making sure that you're able to access services in an equitable way as well.
Yeah, thank you. Because do you think for the future we can achieve the equality? Because obviously at the moment it's very small steps and the inequalities are lessening, it is reducing, but it is very slow and it is improving, and we do get feedback all the time. But there are a lot of people who want the big changes. We're campaigning, we want the same access as hearing communities. Do you feel like we can get there and be on an equal par?
In all honesty, the aspiration is that should be the case. The reality is we know that there will be difficulties, and there will still be difficulties, and some of that is to do with inconsistent systems. So you will find that maybe one part of, and whether that's the council and social care or whether it's health, there may be pockets of where it's being done really well and people are getting real support, but then you find in another area they're not getting the same level of support or the same sort of service. So I think it's something we're working on, but if we're honest, we would say we've got to do a lot better. And I think that particularly with the deaf community, and the provision of BSL, materials and information, that is certainly something we're working on. And I'm sure Sunny will probably be able to tell you a bit more about some of the work we're trying to do in terms of our own adult social care offer to improve that.
Yeah, would you like to explain a bit more now?
Yeah, we're really keen that our information and advice is clear for a lot of our communities. Obviously, when you're starting to look at care and support, the first thing you might want to do is look at information and advice. And if there's inequality in access at that point, then it's not a good starting point. So we're exploring different AI options currently that might support our deaf communities to access information in BSL. We also produce material in Easy Read, which breaks down really complex subjects. There's an explainer picture as well as simplified text. And I know that a lot of my colleagues and myself, when there is a large document, we will most likely look at the Easy Read document because it's a lot easier to understand and distill. So as we've said with the delivery plans, we will hold ourselves to account. We want to make sure that we can improve things as much as we can. But that's why it's really useful to have conversations like today, because the challenge about what is working well for people and what isn't working well for people, it's really important that we hear that so we can feed that back into the work that we do.
Oh, that sounds brilliant, thank you. And it's interesting with the use of AI and also is a hot topic within the deaf community, because I'm not sure if you've seen at the train stations in Peterborough, they've got the boards with somebody signing the announcement. So my personal view is that, well, it really varies within the deaf community. Some are happy that AI are using sign and that they can access that information, but some are thinking that's not a good substitute for a sort of sign language interpreter or translated documents, say in health settings, and also with sort of real life settings with like a real life person. But I think it will be really interesting to see how you're able to use AI going forward within your plans. And one other question I thought is linked to navigation, really. I know it can be really overwhelming to know like how to find certain bits of information, where to find it. Is this strategy going to be quite easily accessible for the communities?
Yeah, we hope so. It's currently on our website, and we've done a whole restructure of the website to make sure that it's easy for people to find. We obviously worked with yourself, CDA, to do a BSL sign language engagement part of the strategy, so people were able to kind of provide their views. We hope that people find the easy read version on there as well, easy to digest. So we do hope that people can find that. And Carol and I, like today, are having conversations with people as well. So in a less formal way, people can always contact us. And as Carol said previously, we do work with a number of different organisations like Health Watch. So any feedback that people provide through those forums also come back to Carol and myself.
Lovely, thank you. So we've got a few comments. Let me just double check. Thank you so much to the audience who are watching and for people giving their comments. Please keep them coming. So Christopher has asked, with the Care Act assessment for deaf people, and if they get direct payments, can it be their choice if they receive sort of a VRS or a video relay system service? Or can it be specific, like they use it for communication needs or deaf awareness needs? Sorry, that was the first question. I think they're split into a couple of parts. There's a few bits there. But so yeah, how can they use their direct payments for the deaf community?
Yeah, the direct payments have been designed to make sure that people can use their money in a way that they want to support their own care and support needs. So in conversation with their social worker, if they feel that actually they've got care and support needs that sit outside of, a 15-minute call, for example, that money has been designed to be spent in a way that enables that person to live a fulfilled life. So if that is how they would want to spend it, that would be within the remit of a direct payment to do so.
Oh, brilliant, thank you. Hopefully that answers your question, Christopher. And then linked to that, how long at the moment is the waiting list for legal care assessment? Sorry, I think they missed your response on the live stream. Would you be able to repeat from the last question your response about direct payments? Sorry.
Yeah, of course. Yeah, so a direct payment is designed for people to take money and spend it on their care and support in a way that they see fit, with as long as it sits within a remit. So the situation you described that Christopher was inquiring into would sit within that, because it would be looking at how he can find care and support and activities and different tools that support his own needs. And if that is the system that you described, then that would absolutely fit within a direct payments mandate.
Brilliant, thank you. And somebody's asked how long is the waiting list at the moment? I believe that's to access the Care Act assessments.
We'd have to check that with you and come back to you, Matthew, if that's okay, because that is something that fluctuates and it depends at which point of the system you're coming in. As we described at the start of the conversation, there are different audiences that we support. So people who are working with our community teams might be people who are over 65 and people with visual impairments and hearing impairments. So that might be slightly different to if you were waiting for a learning disability part of that. So we can find that out and come back to you, Matthew.
Yeah, thank you. And to add to that, for a Care Act assessment, is it usually with a social worker who signs, or do they need to get a sign language interpreter for the assessment, do you know?
It would most likely be that your BSL interpreter is put in place for that discussion. As we go through a Care Act assessment, we have questions in a system that we use to record a care and support plan called Mosaic that specifically asks social workers to make sure that they're asking about the way that we want to kind of have a conversation. So it will look at accessibility tools, the way that someone wants to speak to someone. So that would be part of the Care Act assessment. Then if the social worker would then go and find through a framework contract that we have a BSL interpreter to make sure that that person was in place. So the person who is having that conversation around the care and support plan can fully converse in a way that they see fit and actually have a conversation with the social worker.
It's also important to say that at the council, because we are publicly funded adult social care, we have to abide by something called the Accessible Information Standard, where we have to make sure that people who have a disability or an impairment, for example, can state what their accessible information and communication support needs are, and that, for example, might include needing a BSL interpreter. So therefore, that would be something, as Sunny says, that we would record on the record, and then when we had further interactions with that individual, for example, for an assessment or a review, then we should make sure that obviously that's in place to ensure that the person can feel that they're fully involved with the conversation and actually it can take part fully in the assessment.
Lovely, thank you. So I've got a question. So if a deaf person has never accessed adult social care before, what is the best way for them to get in contact with yourselves if they need, say, further support, or how to start getting involved with you guys?
We have a route that we take people through. So on our County Council website, there is a telephone number to our contact centre, and that's a really great place to have an informal conversation about what your needs might be. At that point, the contact centre might be able to provide you with the information that you need, or they might deem that actually a more in-depth conversation is needed, in which case we have a very specialist team called our Adult Early Help team, and they're really well versed to support a person where there is a little bit more of a need and actually a bit of a deeper conversation. So our Adult Early Help team might be able to speak to someone about equipment that they might need in their home, any tech-enabled care that they might need in their home, if they might need an OT assessment, if they might need reablement or housing options around that as well, and just general information and advice. So the pathway in would be through our contact centre, who would then have that conversation to make sure that they understand if that person needs to go through to Adult Early Help. If that conversation at Adult Early Help suggests that someone actually needs a more formal assessment, a care and support plan, they will then be signposted, passed over to the most appropriate team to do that for them. As we said, we've got community teams that sit in different localities and they support a range of different people, and we also have specialist teams like our learning disability teams as well.
That actually partners such as Cambridgeshire Deaf Association are really crucial as well, because you're meeting people all the time in the community, you're speaking with them, and actually often we some of the initial contact that people have where they want to find out more information about what adult social care is about and whether they actually need support from the council might be through talking with our voluntary sector partners such as CDA, or it might be other ones that we commission such as caring organisations or organisations supporting a particular client group such as Age UK, Cambridgeshire and Peterborough for older people, for example.
Brilliant, thank you for that. So I know CDA have been involved in the making of this strategy. Could you explain more how you feel we've been involved and what we've done?
Yeah, we have had a number of different workshops and listening sessions. So we've been out to our communities to speak to people. We've also ensured that CDA and some of our commissioned providers, as we call them, so people that we, voluntary sector organisations that we work with really closely, like CDA, feature as part of the strategy, so people are aware of all the different elements of adult social care and how it actually plays into the community. Carol also might be able to say a little bit about the BSL work that we did in terms of making sure that the strategy engagement was accessible for people within the hearing community.
Yes, so Matthew, you're well aware that we worked on actually developing the BSL videos for one of the engagement surveys we did for the survey, and that was obviously us providing some initial content to you about the questions we wanted to ask, and then having an interpreter who would actually on video, who would actually then give those responses, and they were actually embedded into the online survey that we sent out. So that people, not only would they see the online questions, but they would also then see for each section a BSL video, and we're able to respond from that.
Oh, brilliant, thank you. So you're talking about the BSL videos, and as you've said, we've worked a lot with CDA and we've obviously worked with yourselves at the council, but that, just to explain to our viewers, is to support the deaf community. It's the same as this, having this live stream, so please do engage. This is for you, this is your opportunity to ask any questions. So is there any main points within the strategy that you wanted to talk about today and use today as an opportunity to share? Just really anything that has come to mind that you think would be good to share today?
Yeah, I think one of the main elements, and we really would welcome the community's feedback around carers support. It's one of the major elements within the Adults Health and Commissioning strategy. We know that there are lots of unpaid carers in our communities supporting people, loved ones, it could be family members, through lots of different circumstances, and the support that we give them and develop over the next few years is really important. So we currently have a live engagement survey for people to complete if they are in that role, if they are a carer and feel that there are things that they want to say to us about their caring experience. That survey, and we can give you the link to that, Matthew, after we've spoken today, but that's open until the 15th of May and gives people the opportunity to say, I'm a carer, this is my experience, and ask a range of different questions around different priorities. So we'd really welcome people's feedback on that as well.
That's lovely, thank you. We'll make sure we add the link to our viewers as well. So how important would you say it is to work with the community and the council and to give updates on the strategy?
Massively. I think it's really important that we kind of have a dialogue. We at Cambridgeshire County Council want to make sure we engage with as many people as possible to hear their experience, their lived experience. And as Carol said, there are lots of different organisations that work within communities that support us to do that. We want to make sure, going back to what we previously said, that the strategy is something that people can hold us to account to. So if we've said something in the strategy they don't feel that is their experience, we'd like to hear that, because the only way that we can improve and focus on areas is if we get that feedback. So that would be one of my main thoughts. Carol, I don't know if you have any other.
Sunny will be aware that at the moment we are gathering the feedback from all different service teams across adult social care in the council about how they're delivering on the action plans we mentioned earlier about the strategy. And then we're going to pull all that information together, see what that feedback's telling us. But we're also actually going to be publishing some of that, the responses and an update on our delivery action plans on our website, because it's not just going to be stuff that we're going to be using. We want to make sure that people are aware of the work that's happening. And as we said, then people can actually come back to us and say, oh, you're saying here you're actually doing this, but that's not maybe our experience, or we've had some problems with that, or that's really great, that's working really well. So by putting that information onto our website when we've actually gathered it, that will allow us to actually interact with people and give that sort of ongoing feedback and to actually make improvements as we go along.
Oh, brilliant, thank you. So we've had another question in. From Thomas. So this strategy, has this ever happened before? Have you had strategies in the past?
We have many years ago. There hasn't been a precursor to this strategy for some years. So we did have a strategy, probably early 2000s, called Transforming Lives, which helped us develop different social work practice around changing the conversation and looking at our care and support planning process. That also entailed different things like talking to communities and working with our voluntary sector organisations as well. But we haven't had anything in place like this for some years.
Yeah, we did. One of the drivers or the ideas behind getting this strategy was we wanted to actually have a direction of travel, a clear roadmap for what we were doing. And it was felt that we had strategies for different things sort of across the council, but things were not joined up. And as we said earlier, it didn't join up with the overarching strategy for the whole or vision for the whole council. So the idea was then that actually this work would be this nice, we called it a golden thread, or a way that we'd actually see from the top to the bottom about actually what we should be doing, and to try and make that as clear as we could and as accessible as we could for our partners, the community, and also our own staff, actually, to make it clear for our own staff what we're actually working towards.
Oh yeah, it's really important. So we've got Chris again. Thank you, Chris, for commenting. And if anybody else has any comments, please do ask away. We've got about 20 minutes, maybe a tad longer, if there are some more questions. So please do put them in the chat box if you do. So the council, is it planning to have a VRS, so video relay interpreting service at all? Do you know?
I'm not
So yeah, video relay service, VRS is what it's called.
Yeah, I'm not sure, but again, Christopher, we can check that. And actually, if the feedback is that Christopher's experience there is something missing there, we'd love to hear a little bit more about what that is and what his experience is, because it's really important that we do make sure that we talk to people in a way that they want to be spoken to and engage with them in the right way. So if that's an important element for Christopher, we'd really like to hear about that. We do, as a local authority, as Carol says, have a mandate to make sure that people access information in a way that is tailored to them. So if there are specific areas that we are lacking on, then please do let us know, because once we know, we can start to look at it, A, if there's anything that we can do about it, B, start to plan for it, and C, if the answer is we can't, make arrangements now, we can at least have that conversation about what is needed and how we can mitigate against that.
Brilliant, thank you. Because like you said earlier with AI and technology, it's just so important. So VRS, it's a video relay service, so a video interpreter. So if you could look into it, I think a lot of deaf people say that's really important. We have Mark, so a new commenter, thank you. So how do you try and fund prevention work? And then what are you investing in your service?
Yeah, that's a great question. Oh, sorry, Carol. Go for it.
Yes, so we do invest in our prevention and early intervention services, and a lot of that is through, obviously, external partners. So people like, obviously, Cambridgeshire Deaf Association, but also, as we said, other voluntary and community sector partners who are out in the community on a day-to-day basis, supporting different parts of the community. So that's really important, and we try to commission those services because they are trusted services on the ground who people know and understand and respect. So that's a key part. But we also have our own internal prevention early intervention services that cover a variety of activities. So, for example, we've touched on the fact that we have things like our technology-enabled care services, which is obviously it can be anything from the sort of kit that you might have in your own home. And in fact, actually, this week they've been launching information about a virtual smart flat, because we have an in-person flat where people can go along and find out more about some of the sort of monitors and sensors and equipment they might be able to use, but also they wanted to be able to show people virtually by looking at it online about what those sort of kit might be available. We also have a small welfare benefits team who help people who've been able to access or to apply for benefits and maximise their income, which we know in this cost of living crisis is really valuable. We have occupational therapy. We have something called a reablement service, which is particularly focused on when people maybe are being discharged from hospital, and to help them to maybe get back on their feet, regain their skills. It's a short-term thing, because sometimes people might need a little bit of support, maybe over, say, something like a 6-week period, to regain some of their confidence and skills, and have people coming in to help them with that. So there's a lot of different internal services that we have as well that support people's prevention, the prevention early intervention, so that their needs don't escalate, and actually allows people to feel that they can cope better independently in the community.
That's great, thank you. And that follows on nicely to the next question. So what proof do you have in prevention and stopping these sort of things happening? Have you got any statistics, evidence?
Yes. Well, you go. No, you go ahead.
We know that if we support people at an earlier stage, then it can lessen their needs. So we know that actually putting money into preventative activities. So, for example, if somebody came to CDA and you thought, oh, actually, this person feels like they might be struggling, you might be able to signpost them to benefits that they might need. There might be kind of care and support needs there that you might be able to signpost to as well. But capturing that person earlier, rather than waiting for them to get into crisis, is really important, because it provides people with the options to help themselves. If you know about things, then you can then decide whether that's right for you. A lot of people that come into adult social care come in at crisis point, where there could have been things that we put in place that could support them. As Carol mentioned, there is tech which can be put in people's home. There can be grab rails, for example, that could support people. There's lots of different things that can be done downstream so people don't escalate in their needs. So I think in terms of prevention, it's really important that we do invest in that kind of area, especially working alongside our voluntary sector partners. It's really important. That's a really bedrock of what we do within adult social care, actually.
The council that will provide the care and support, but actually there's a wide range of services out there that are delivered through voluntary and community sector partners, but also some, as we said, some services that can actually help people to stay independent, safe and well, that the council can assist them with as well. Because most people, that's what they want to do. They want to stay living in their own communities with their family and their friends. They're not looking for that more intensive, longer term support. And I think that's maybe a misconception people have. Actually, what the council wants and what people want is the same. People want to be able to stay in their own homes, in their own communities with the people they know. But just sometimes they need a little bit extra help to allow them to do that, and that to help, as Cindy says, to avoid maybe going into a crisis situation further down the line.
Yeah, thank you. So how does the council support and help the charities and all these partners? Like you said, it's tough financially in the current climate. So what do you guys do?
Yeah, there's a range of different ways that we work with our voluntary sector partners. So there are long-term contracts that people can bid for. So, for example, if there is a service that we have designed a service specification for, organisations can bid for that piece of work. So that would give them financial stability over a set period of time. Contracts are likely to be anywhere between 2 to 5 years, possibly sometimes longer, which enables an organisation to kind of have some money coming in so they can forward plan. There's also a number of small grants that have come available as well. So through our public health partners and our commissioning colleagues, small piece of money for very bespoke pieces of work comes available. It's really important for us at Cambridgeshire County Council to have a really strong and vibrant voluntary sector network. It's something that we've relied on through COVID, for example. Before we came on live chat, we were just talking about the work that you've done here at CDA to make sure that through COVID you were able to engage with people through the live streams that we're doing now. So that work is really important, and I think as a local authority, the delivery of the strategy relies on a lot of that network of delivery. It isn't, as Carol said, just the local authority, it's our range of partners as well. I don't know if you have anything to add, Carol.
We were involved for a number of years with a particular funding stream that the County Council did, which was very much this idea of that sort of small seed funding to local voluntary and community sector groups, parish councils, and so on. The idea was that if people had ideas that would help people to stay independent, safe and well in their community, that actually they could come to us and test some of those ideas out. And actually we had a wide range of grants that were given out under that programme. In fact, I think we actually gave some funding to Cambridgeshire Deaf Association as part of that as well. And so there are always going to be coming online different small grant funding streams that can test ideas out. But also we try to highlight where there's national grants that come through as well, that maybe voluntary sector partners in concert or together with the health system or with the council can apply for.
That's good to know, thank you. So we've got another comment from Lil. So just to let you all know, we've got about 10 minutes left. So this is your last opportunity to ask any more questions to Sunny and Carol. So Lil said that your website, they feel, needs to be a bit more accessible. There should be more information in BSL videos, and it should give more information about different topics, different access information, everything that you have. They've just said if you could make it more accessible, that would be great. Would you like to respond?
Yeah, thanks, Lil. That's a really great point, and we are working within adult social care really hard to make those improvements. We totally agree in terms of how you find information on the website. It can be quite difficult to navigate. So we're working with our web development team to make sure that the structure of the adult social care content is improved, that people can link into sections that take them on a journey that you might want to find other information, and it's all linked. And any feedback about how people are using the system, the website, and actually finding information or the barriers that they're facing, we would love to hear that feedback. So, if people are coming against obstacles and they let you know, Matthew, then you can let Carol and I know, because we will feed it back. All that information is really rich and we really welcome it. So conversations like this is really great because it unearths things that we might not know, how people are struggling to find information on that website. So if there is any specific feedback, we would really like to hear that.
Yeah, thank you. And then we've got Neil. I just wanted to add to that. And he said it's really important because you don't want to have to rely on somebody else to translate that information from your website from English into sign language. It's the same sometimes for emails or letters. They want to be independent rather than have to rely on somebody. And yeah, if that could be corrected in advance on your website, that'd be much appreciated.
Thank you. That's good feedback.
And we've got another comment here. they're saying, how are you measuring your success for the next several years until 2028? How is the strategy going to measure it? What terms are you doing that in?
Yes, do you want me to?
Well, you could start off, yeah. 'Cause
We have a set of delivery plans that sit beneath each of the Aspire ambitions. So they really look at some of the headline work that we're doing around each Aspire ambition. And we're asking for reports on that work on a 6-monthly basis, so we can start to build a narrative about actually what's happening in practice and what impact is that having on people. So we do hope, as we work through the delivery plans, we're only just doing the first reporting period now, we'll be able to come back to you and give you a little bit of an outline of what we've done, what people have said that they wanted to see, and what we've done to respond to that. Because I think, as we said at the start, actually the delivery of this is what people are interested in, rather than the kind of the big ticket item, but actually what does that mean to people on the ground. So we will be working on that over a 6-monthly period up until the end of the strategy in 2028.
Of that feedback and where we're at on our website as well, so it won't just be something we'll be discussing within the council, it'll actually be out on the website for the public to read as well.
That's great, thank you. So how will the reorganisation of the council affect this strategy?
Oh, that's a good question. So obviously at the moment, for people who are watching the live stream, Cambridgeshire County Council, like a number of councils across England, are going through something called local government reorganisation. This is because in somewhere like Cambridgeshire, we have different layers of governments or local governments. So there's the county council, and we deliver things like adult social services, children's social services, that kind of thing, education. But then you'll also know you'll have things like the district councils, like we're sitting in Cambridge City, a council area, and they do things like, organise your council tax and do your bins and things like that. So the idea behind local government reorganisation is the government's thinking that if you actually have reorganised, so you have councils that do all these different services, that might be more efficient, and it might actually produce savings in terms of money, because some services will be duplicated across different councils at the moment. So it might be that you've got different HR teams or human resources teams across the different councils, or you might have different communications teams across the different councils, whereas if you have one council, you only need one human resources team, one communications team. So there's been an ongoing process over the last sort of year or so in terms of actually looking about how you might do that in this area. And the government asked the local councils, so that's Cambridgeshire County Council, the 5 district councils in Cambridgeshire, but also Peterborough City Council, to go away and think about how they might be able to reorganise themselves, to put some options through to the government, and then the government consulted people in the local community about that. And we're waiting to hear some point in the summer, we're not sure when, what their decision is about how they will structure the councils in future. So we're waiting for that. But in the meantime, what I can say is that the council is looking at how we might need to deliver these services in future. And obviously that's part of what the strategy is about. But also in the back office, we're thinking about if we have to reorganise, what will we need to know to actually do that across all the different services. So actually there's work going on even now, even though we don't know at the moment what the setup will be, to actually prepare for that local government reorganisation, which should happen in the spring of 2028.
Okay, thank you. So we're now running out of time, but we've got 3 more comments. One's from the audience member and 2's from me. So somebody has asked, how are you managing sort of your staffing, your resource constraints basically at the moment? How are you managing all of that?
Very good question.
Yeah.
As everyone's probably aware, public sector spending and voluntary sector spending has been on a decrease for many years. And we're seeing people in more complex circumstances as well, which means that the support that we offer people is sometimes a little bit more than what we would have done possibly 10, 15 years ago. So it is a real balancing act in terms of the finances. And as Carol explained in the structure of local authority, we work at Cambridgeshire County Council, and they're responsible for a huge area of Cambridgeshire. And they're responsible for things like potholes, they're responsible for things like children's social care, adult social care. These are really big ticket items in terms of cost. I think we're really fortunate in Cambridge that we have really quite clear leadership in terms of the budgetary spend that we do. There's a budget planning that happens on a yearly basis with a business planning cycle. So we're always looking at ways that we can be more efficient as a local authority. But the constraints that we face within Cambridgeshire is national. We know that adult social care swallows up a huge amount of local authority budgets. But what we try to do is be smarter with the money. And as we were asked earlier around prevention, spending on prevention does save in the long run. So we have a good prevention offer within Cambridgeshire, but it's always a juggling act every year in terms of the budgets. The money comes in and the money goes out, so we have to balance those books. And as a local authority, we need to have balanced books to send back to government. We haven't got any room for overspend.
Yeah, thank you. So then a couple more questions. What is the thing that you're most proud of with the strategy?
Oh, great question. I guess for Carol and I, during the process of developing this strategy, we have spoken to so many people. So over 320 people engaged in different ways through the development of the strategy. It was something that we were very keen we didn't do in isolation. So all those voices, all those priorities for people have been really fed in and distilled into the strategy. Carol, I don't know if you agree.
Sometimes it was really deep conversations we had with people that actually gave the biggest sort of insights and helped to really focus in on what we needed to make as our priorities. So people would really share difficult experiences sometimes that they'd had, but they did it because they wanted to make things better for people. And we hope that actually the final result, when we went back to those people and said, right, actually what you told us and the difficult things you shared about your experiences actually informed not only this strategy, but other work we're going into. And certainly I think that was, really important to us, that it really reflected people's feedback and their ideas. And that people were really honest with us and said, sometimes they would say, that's been great, that's worked really well, but also they would say, this is a challenge, this is a problem. A bit like, obviously, some of the people who are watching the live stream today have said about some of their challenges about accessing information through our website, for example, because there's not enough BSL information on there, etc. So yeah, that's I think probably what, for me as well as Sunny, I think because that's the kind of role we had, which was that engagement role, was the most valuable of the experiences we had.
Yeah.
So thank you. Thank you so much for joining, because it's been brilliant to get an overview of this strategy from obviously now till 2028. Is there anything that you would like to see happen across those years, and anything that you'd like to implement by the time the end of the strategy is here?
I think a few of the comments that have come through have been really helpful, because it actually shows us what's important to people. It is about things like accessing information in the right format for you. And these are things that we should be getting right now. We're in 2026, and I think having a strategy will help us hold us to account so we can start to look at some of these changes. I mean, we won't make big promises because, as we've said, budgetary pressures, and we are a local authority, so we sometimes have to go through governance. But I want to let people know that the things that are important to them are important to us as well, and we do want to make changes. We work within a really good structure, and we have some really proactive people who want to make these changes, and the feedback that we've had today in the comments has been really helpful.
The fact that we're doing some work to refresh our all-age carer strategy, and I think the reason why we're doing that is because it can't stand still. The challenges are out there. people are finding it more and more of a struggle across the board, and so therefore we really needed to respond to that and to people's feedback. So it's not something that's just we've written the strategy and it's there and it's an aspect, or as it were. It's actually something that's live and we're actually going to be working on throughout this period.
That's brilliant. Thank you so much. And thank you both for coming and taking the time to be here today. I hope you found it beneficial, and I hope you guys watching have as well. Thank you all to everybody who has watched, who has engaged, who have made comments. As you can see, Sunny and Carol have been making notes that they will take away to the council, and let's see what happens in 2028. Thank you all for watching. Goodbye.